Hey there, folks. It's 11:35 here at my home office. I need to go pick up my kids from school in a few moments, but I guess I have about 45, maybe 50 minutes to report some exams, and I thought to myself, why not do it on a live stream? So let me share the screen. Yes, this is my screen. I'm going to open up a CT scan of the abdomen so we can enjoy reporting it together. It's downloading. It will be ready in a few moments. This is a male patient, 47 years of age. It says he has a Blumberg sign, which says it's an acute abdomen. So this is an acute abdomen of a male, 47 years of age. So this should be fun, especially for you guys watching. So I guess we are live, and I'm about to share the screen. Oh, open up the exam. Yeah, it's there. We have only a non-enhanced CT scan of the abdomen. Let's scroll down and look for signs of an acute abdomen. Oh yes, did you guys see it? It's incomplete. The volume is incomplete, but there is no need for volumetric images of the pelvis because we can already see the motive for the acute abdomen. I'm just going to scroll over the images a few more times. Prostate and seminal vesicles are fine. This is not a stone. This is a phlebolith, a calcification of a vein. Rectum, colon is fine. Nothing major on the pelvis, not even the bones. So let me grab the actual volumetric acquisition. Liver is fine. Gallbladder also. Pancreas is okie dokie, as is the spleen. Kidneys, okay. A probable kidney cyst right there, small kidney cyst, it's okay. He is 47 years of age. That's fine. That's proper aging of the kidneys. Adrenal glands are okay. Let's scroll down until we find the cecum right there on the right iliac fossa. And of course, this is the appendix. The appendix, this is the terminal ileum and the ileocecal valve. And just below that, we have the appendix. It's huge. There is fat stranging right beside it. So this is an acute, uncomplicated appendicitis. 1.7 centimeters. This is it. This is an acute, uncomplicated appendicitis. Just let me pop this chat out so I can see if anyone is sending comments as we keep on reporting. So nothing major here, just an acute appendicitis. classic acute abdomen. Let's go. One 1.8, right? Yes, 1.7. So acute appendicitis, we are off from a good start. Let's grab the next exam. This is a female. She is 70 years of age, and it seems she has some major respiratory distress. Let's see if we can. I have a template, of course. I have a template for chest CT scans of old age patients. And yep, she is in very bad shape. There is a tracheal tube. Oh, this is major. Let me just grab a proper volumetric sequence. This is lung window and lung recon, and this is soft tissue recon and window, of course, for the mediastinum. I'm just going to window a bit to look for signs of trauma. There is major, there are major breathing artifacts. So movement, the breath movement artifacts, and the tracheal tube is properly set. She has a huge heart, a lot of atherosclerosis. There is thickening of the interlobular septa, smooth thickening. This could point to edema. There is also consolidations, ground glass opacities, partial atelectasis, and at least a moderate pleural effusion on both sides. We can also say there are signs of emphysema, paraseptal emphysema, and small subpleural bubbles. I don't know, but this aorta seems pretty much enlarged. Kinda. Hello there, Hodem. How's it going? What's up, my friend? So, aorta seems fine. Pulmonary truncus as well. Just atherosclerotic. Lots of atherosclerosis both on the aortic valve and the coronary vessels. Also, the rightmost intraventricular valve is partially calcified. This is old age. There is diffuse disease of the thyroid gland. And of course, as always, some lymph node enlargements. So let's go, let's report it. Tracheal tube. Moderate pleural effusions. diffuse atelectasis of the lungs, especially the lower lobes. And on the rest of the lungs, there are thickening of the septum, ground glass opacities, and consolidations. And just a tiny emphysema with subpleural bubbles or blebs. Enlarged heart. Atherosclerotic changes of cardiac valves and coronary vessels. And this is it. Oh, lymph node enlargement. So we are done. Just finishing up the report. So we can go to the next one. Just a sip for my coffee. Why not? It's cold and awesome. Yeah, guess we are done. Let's go to the next one. The next one is a CT scan of the head. Head CT scan. 64 years of age, male patient. It says he is out of his mind, some kind of altered state of consciousness. So, did I download? Yep, it's here. It's here already. My internet connection is flying today. Thank God. Wow. So, this is a very, very sick patient that is diffuse microvascular disease all over the white matter, supratentorial white matter. There is even a small ischemic lesion right here, another one right here. So tiny strokes, probably another right here. There is diffuse decrease in brain parenchyma size, atherosclerotic plates on the vessels, diffuse calcification of the pineal gland, and we are looking for attenuation asymmetries that could point us to an acute stroke superimposed on these chronic changes, chronic microvascular changes. This is an enlargement, an asymmetric enlargement of sulci, probably due to malpositioning of the patient. This isn't what we're looking for. We can't really tell. I can't really tell. I don't know you guys, but I can't really tell if there is for sure an acute vascular lesion on this patient. This is just chronic disease to me. I'm going to report it and go on my way to the next exam. Oh, I have a template. A severe white matter disease and a bunch of tiny strokes on the brain on both sides of the basal ganglia. So this is it. We are fine. A mild supratentorial hydrocephalus due to the shrinkage of the brain parenchyma. There is indeed diffuse white matter disease all over the place. So just summarize the report and send it away so we can go to the next one. And we are done. Let's grab another CT scan of the head. This is a 77-year-old patient. It's a male patient and they are looking for a stroke. So, probable stroke, old age. Let's see what we can diagnose. Oh, this is a very old CT scanner. Bear with me, guys. Let's roll and look for signs of an acute stroke. I was expecting a much worse brain for this patient since he is almost 80 years of age. This is a quite normal scan. We have a few calcifications right there on the right frontal lobe, right there also. I'm just measure that to have a basis of reference, 4 millimeters. So 2 on the right frontal lobe and 1 on the left temporal lobe. Another one right there on the right temporal lobe. Of course, we have carotid calcifications. Fourth ventricle is fine. A lot of tortuosity of the vertebral basilar circulation right there. And if you are watching this video after the live stream, don't forget to hit that like button and consider subscribing to the channel. I really appreciate it. It helps our channel grow and makes me feel like this isn't a complete waste of my time. Another small calcification right there. I'm just going to window the images to be sure there is no stroke that we can tell just by analyzing a CT scan. So Usually strokes in this age group are related to the basal ganglia and the middle cerebral artery. So let's look for asymmetries on the middle cerebral artery territory. No, it's kind of symmetric, really symmetric actually. This is a very well preserved brain for a 70-year-old male. I can't really tell much more than those tiny residual calcifications. This patient is just fine. So I'm going to grab another template since this is normal aging. There is no diffuse white matter disease. Just going to report the calcifications and go on my way to the next one, of course. So calcifications have been reported and also the atherosclerosis. No signs of stroke, acute stroke in this case. If it's a hyperacute stroke, it just won't show up. And if it's not a stroke, just a acute transitory vascular event, it won't show up either. It would just show up. It would show up fine in an MRI, but not on a CT scan. So it's gone. Let's grab a CT scan of the paranasal sinuses. I guess this is how you're supposed to pronounce that. I have a template. I am downloading the images right there. Are the images here? Yep, they are here. I'm just going to do an MPR. MPR is fine. This is a nice scanner, great images. We can look for really any disease. Most of the diseases right after a sip from my cold coffee. Let's see what it says here. It says he has sinus disease of some kind. So if it's sinus disease they want, let's look for sinusitis as usual. So there is thickening of the mucosa, left frontal sinus, both maxillary sinus, a few of the ethmoidal cells. There is a large I don't know how to call that. I just know that in Portuguese, just realized, but there is the right middle concha is filled with air and enlarged in volume. Also, in lesser extent, the left one. Inferior conchas are fine. And let's look for orbital disease. No orbital disease. No clear signs of fractures. Did you guys look. Did you guys find any fractures? I couldn't find any fractures. My mastoids are fine. No mastoiditis. Temporal mandibular joints look fine. And there is a shift, a deviation, a tortuosity towards the right of the bony septum. So we have mild sinusitis, probably not an acute case. There is no obstruction of the passageways, the drainage of the sinus. There is pneumatization of the middle conchas and a nasal septum deviation, tortuosity to the right. This kind of thickening of the mucosa could point us to small cysts, retention cysts, or tiny polyps, but it's just very, very mild disease, nothing to worry about. So let's report it. Mild thickening of the mucosa of the nasal cavities and most of the paranasal sinus. We have pneumatization of the middle conchas. And a nasal septum deviation to the right. And this is it. Now just summarize the report to make it easier for the referring physician to read. And we are done. Yet another CT scan reported. Let's grab a abdominal CT scan now. Downloading the images. This is an unenhanced CT scan of the abdomen of a 11-year-old child, male child. And it says he has epigastric pain and inguinal pain, no trauma. So that is a mysterious disease that should show up on a CT scan that causes both epigastric and inguinal pain on a 11-year-old male child. So this is it. No contrast enhancement, which is terrible for such cases, but let's see if we can if we can find a meaningful justification for the patient's complaints. He had a full meal. His gastric chamber is pretty much filled up with food, although the gallbladder is still full. So this probably has taken place a few moments before the CT scan, or there is not much fat on the food he ingested, so the gallbladder wouldn't contract and release its contents. Let's look for the appendix. The appendix is right here, right here, right over here. See? Right over here. It doesn't seem enlarged, nor there is any signs of fat stranging surrounding it. So I don't think this is an acute appendicitis. And usually patients with acute appendicitis can't eat this much because sick. So when I see a full stomach on a 11-year-old child, I can't really tell. I can't really expect to see an acute abdomen in such cases, because if you have an acute abdomen, you aren't really that hungry. So there is already a prostate. The urinary bladder is fine. There is some shakiness, but overall, it's a good quality exam. Although there is no contrast enhancement, the pancreas is fine. Also, the spleen is fine. No signs of kidney stones. No signs of hydronephrosis. Lymph nodes are fine. Colon also. Appendix also. I can't tell. No ascites or ascites. No ascites. No free fluid. Excessive free fluid in the abdominal cavity. I really can tell. The bowel is fine, as much as we can tell. Liver isn't enlarged. So this is a normal exam, no matter the complaints of pain. Just going to put a little phrase saying the appendix is fine, just to be sure, and avoid complaints from the referring physician. And we are done once again. Let's go for a head CT scan once again. It's taking a bit to load. Oh yes, let's see if we have anything. Yes, screen is healthy. So it's taking a bit to load. I'm going to reload the page. Don't forget to hit that like button and subscribe to the channel. This is the time. I don't know if it's the platform. Yeah, it was just a hiccup from the platform. It says this is a 69-year-old patient. She is female, and it says she has she came to the hospital 2 days ago with clear signs of stroke. She is stable, and they ordered a CT scan. She has two other CT scans from the 26th and the 27th of September. I'm going to download it as well, just to be sure we don't miss anything. So the scan from the 28th of September is here. This is our exam, the one we are supposed to report. That is chronic sphenoidal sinus infection right there. Oh, this is an acute stroke right there. Do you guys see? Yeah, acute stroke on the left thalamus. So this is a midbrain, a diencephalon stroke right there. It's hypoattenuating, it's mal-defined, ill-defined, and it has some tiny mass effect over the third ventricle right there. So this is an acute diencephalon stroke, microvascular stroke right there, right there. So it's good we have downloaded the previous exam. So let's put it right here, 27, and this is 28. I'm going to scroll the 27 right there, and it was smaller on the 27. It got bigger on the 28th. Let's grab the 26. I don't think they didn't report it. This is too easy to look, too easy to find. It seems the report from the 26th of September said he didn't have a stroke, and the report from the 27th said he had a stroke, a left thalamus stroke. So let's open up. This is the 26th. Let's look for, yeah. What do you know? Right there. No signs of stroke on the 26th because it was a hyperacute stroke. And as soon as enough time had passed, the stroke showed up and it got worse on the next day right there. Oh, it is indeed a acute stroke of the left thalamus. Also, what we have here, we have moderate white matter disease, chronic white matter disease. We have diffuse decrease in brain volume, and we have no signs of hydrocephalus. The ventricular system is fine. So we have chronic white matter disease, moderate chronic white matter disease, plus an acute stroke on the left thalamus, which is unfortunate. It's a very serious disease. Let me just grab a template. Fine. And we can properly describe the acute stroke. And we are almost there. And we are done. Another exam down. And we're just going to report a final CT scan of the brain. And I'll go pick up my kids from the school. Just a tiny sip from my cold coffee, because coffee is awesome. The images are here. It says this is a 12-year-old female child. She had passed out 3 months ago, had trauma, and she is feeling dizzy once again, and it has thrown up. So this is probably nothing, but I'll just copy and paste my template right there and scroll through the images, and you guys can tell if there is any signs of acute brain disease. And we are scrolling from bottom to up, and we have reached the top of the skull, and we are going to scroll now from top to bottom. Let's see if we have any kinds of bone trauma and fractures. No bone trauma, no fractures. Mild sinusitis, nothing major, nothing of importance. Cerebellum, fourth ventricle, and brainstem are fine. Temporal, occipital, parietal, and frontal lobes seem just fine. No hydrocephalus, no signs of acute hemorrhage, no midline shifts or deviations. The pituitary gland looks okie dokie. Vessels are fine, no abnormal calcifications. This is fine. And we are done. I'm just going to see if there is anything on the orbits and the masticatory and buccal spaces, also in this small portion of the cervical spaces we usually scan on brain scans. So no hyperattenuation of the sinus, which could point to us some kind of acute thrombosis. No signs of that. So we are okay to go. If this is a normal exam, I'm just going to sign it off. And I guess we are done here, guys. Thank you so much for watching. Hit that like button, consider subscribing to the channel, and share this live stream with people you know enjoys diagnostic radiology. And I'll see you in the next live stream. So long.